If you're a man in your 60s, what I'm about to share might be uncomfortable to hear, but it could save your relationship, restore your confidence, and transform your intimate life. Because here's what most men don't understand. The women in your life, your wife, your partner, the women you're dating, are not telling you the truth about what they actually want and need sexually. Not because they don't care about you, but because they're afraid of hurting your feelings, damaging your ego, or making you feel inadequate. I'm about to reveal what an experienced woman in her 60s told me during a consultation, words that opened my eyes to a massive communication gap between men and women at this age. Words that explain why so many relationships lose intimacy after 60, why so many men feel rejected and confused, and most importantly, what you can do differently starting today to create the connection and sexual fulfillment both you and your partner desperately want. I'm Dr. Madison Li, board-certified urologist with over 12 years of experience, and today I'm sharing the honest, unfiltered perspective of mature women about what men in their 60s are getting wrong about intimacy, sexuality, and relationships. This isn't about blame or shame. This is about understanding. Because when you understand what women actually want and need at this age, everything changes. The pressure lifts. The performance anxiety disappears. And intimacy becomes easier, more natural, and more satisfying for both of you. But here's what makes this so important. Most men in their 60s are operating on outdated assumptions about what makes women happy sexually. Assumptions from their 30s and 40s that no longer apply. They're focused on the wrong things, measuring success by the wrong metrics, and completely missing what their partners actually care about. The result? Frustration, disconnection, and the slow death of intimacy in relationships that could be thriving. This woman I'm about to quote changed how I counsel my male patients. Her words were so honest, so clear, and so universally relatable that I've shared her perspective with hundreds of men since then. And the men who listen, who really hear what she said, report dramatic improvements in their relationships and sexual satisfaction. Stay until the end because I'm revealing her complete message, explaining why each point matters from both a female psychology and male physiology perspective, giving you specific action steps you can take immediately, and showing you how to have the conversations with your partner that could transform your intimate life. This information could be the bridge between loneliness and connection, between frustration and fulfillment. Let me start by telling you how this conversation happened and why it matters so much. 3 years ago, I had a consultation with a couple in their mid-60s. The husband, Robert, came to me concerned about erectile dysfunction. Standard case. He'd tried medications with partial success and wanted to explore other options. During the consultation, his wife, Patricia, was present. This is common. Partners often attend these appointments. What was uncommon was what Patricia said when I asked if she had any concerns or questions. She looked at her husband, then at me, and said, "Can I be completely honest, doctor? Even if it might hurt his feelings?" I assured her this was a safe space for honesty. Robert agreed, though he looked nervous. What Patricia shared over the next 10 minutes was one of the most enlightening conversations I've had in my career. She spoke with the wisdom of someone who'd been married for 38 years, who loved her husband deeply, but who'd been carrying frustration and unspoken needs for too long. She said, "Men in their 60s, my husband included, no offense honey, don't understand what we actually want anymore. They're so worried about their erections, about performing, about being the man they were at 40, that they've stopped paying attention to what would actually make us happy." She continued, and I took mental notes because what she said resonated with conversations I'd had with dozens of other women in similar situations. After the appointment, with their permission, I wrote down the key points she made. I've since shared this framework with hundreds of male patients, and the response has been overwhelmingly positive. Men say things like, "Why didn't anyone tell me this sooner?" and "This completely changed how I approach intimacy with my wife." Here's the thing. Patricia isn't unique. Her perspective represents what countless women in their 60s feel but rarely express clearly to their partners. There's a massive communication gap. Women assume men should just know these things. Men assume that what worked at 35 still works at 65. Neither talks openly about the real issues. The result? Declining intimacy, increasing frustration, growing distance, and eventually, sexless relationships where both partners feel rejected and unhappy but don't know how to fix it. What I'm about to share is Patricia's message, expanded with insights from other women I've counseled and from research on intimacy in older adults. Think of this as the honest conversation your partner wishes she could have with you but doesn't know how to start. This is what men in their 60s don't understand. Pay close attention. This information is gold. Point 1. We don't care about your erection as much as you do. Patricia said, "My husband is obsessed with his erection. Can he get hard? How hard? How long does it last? He's so focused on his penis that he's forgotten I have a whole body. Doctor, I would trade his perfect erection for 20 minutes of his full attention and affection any day." This is critical. Men in their 60s often measure sexual success by erectile function. Hard equals success. Soft equals failure. But women don't think this way at all. For women in their 60s, emotional connection, physical affection, and feeling desired matter infinitely more than penetration. In fact, many women at this age find prolonged penetration uncomfortable due to vaginal changes from menopause. What they want is intimacy, touch, attention, and the feeling that you find them attractive and desirable. When you make your erection the centerpiece of sexuality, you create pressure for yourself and disconnect from what she actually wants. She feels like you're having sex with your ego, not with her. What to do instead? Focus on full-body intimacy. Kissing, touching, massage, oral stimulation, manual stimulation. Make these the main event, not foreplay to penetration. Your hands and mouth don't have erectile dysfunction. Use them. Most women over 60 can achieve more satisfying orgasms from clitoral stimulation than penetration anyway. Stop making your penis the star of the show. Point 2. Foreplay doesn't end after 5 minutes. Patricia said, "He thinks if he kisses me for 3 minutes and touches me for 2 minutes, I should be ready. Doctor, I'm 64 years old. My body needs time. 20 minutes minimum of touching, kissing, building arousal. And honestly, if that's all we did, I'd be satisfied. The problem is he rushes through it to get to the main event that I don't even need or want." This is huge. Women's arousal timelines increase with age. Blood flow to genital tissues is slower. Natural lubrication takes longer to develop. Psychological arousal, getting her mind ready, takes more time when life is stressful or she's distracted. Men in their 60s often still operate on the sexual timeline from their youth. Quick arousal, quick intercourse, quick finish. But your partner's body has changed. What worked at 35 doesn't work now. What to do instead? Plan for 30 to 45 minutes of intimate time, most of it being sensual touch, kissing, and gradual arousal building. Don't rush to genital contact. Start with her neck, her back, her thighs. Build slowly. Pay attention to her responses. If she's not actively responding with sounds, movements, or engagement, you're moving too fast. Slow down. Many women report that when men take their time with foreplay, they don't even need or want penetration. The journey becomes the destination. Point 3. Emotional intimacy comes before physical intimacy. Patricia said, "We had an argument on Tuesday. By Thursday, he wanted sex like nothing happened. I'm still hurt from Tuesday. He wonders why I'm not interested." Men compartmentalize. Women don't. If we're emotionally disconnected, we can't be physically intimate. This is Relationship Counseling 101, but men in their 60s often forget or ignore it. You can't have unresolved conflict, emotional distance, or lack of communication during the day and expect sexual enthusiasm at night. For men, sex can be a way to reconnect after conflict. For women, reconnection has to happen first, then sexuality can follow. Trying to use sex as the reconnection tool doesn't work for most women. What to do instead? Maintain emotional intimacy daily. Talk. Really talk. Ask about her day, her feelings, her thoughts. Listen without trying to fix or solve. Apologize when you're wrong. Express appreciation and affection regularly, not just when you want sex. Show physical affection throughout the day, hugs, hand-holding, kisses, with no expectation of it leading to sex. This keeps the emotional connection strong, which makes physical intimacy natural and easier. Point 4. We want to feel desired, not like a chore on your to-do list. Patricia said, "Sometimes it feels like he's servicing me. Like I'm an obligation. Okay, let me make sure my wife is satisfied so I can say I'm a good husband." That's not desire. That's duty. I want him to want me because he finds me attractive and desirable, not because he read an article that said he should pay attention to my needs. This cuts deep. Many men, trying to be good partners, focus on technique, on making sure she has an orgasm, on going through all the right steps. But it becomes mechanical. She can feel the difference between genuine desire and dutiful performance. Women want to feel wanted. They want to feel that you're touching them because you're turned on by them, not because you're following a script from a men's health magazine. What to do instead? Cultivate genuine appreciation for her body and her sexuality. She's changed physically. So have you. Find what you find genuinely attractive about her now. Her smile, her skin, her curves, her responsiveness. Tell her specifically what you find attractive. Not generic compliments, specific observations. "I love the way your body responds when I touch you here," or "You're so beautiful when you're relaxed and present with me." Mean it. If you can't find genuine desire, work on your own mindset, because duty-based sexuality kills intimacy for both of you. Point 5. Communication about sex is not optional. Patricia said, "We've been married 38 years and we still can't talk about sex directly. He assumes what I want. I assume what he wants. We're both wrong most of the time. We're adults. Why is this so hard?" Sexual communication is terrible in most long-term relationships, especially in couples over 60. Years of habits, assumptions, and unspoken expectations build up. Neither partner knows what the other actually wants anymore because they've never asked explicitly. Men assume their partner's needs haven't changed or that she'll speak up if something's wrong. Women assume men should just know what they want or that bringing it up will hurt his feelings. Both suffer in silence. What to do instead? Have explicit conversations about sexuality outside the bedroom when you're both relaxed. Ask questions. What do you enjoy most about our intimate time together? Is there anything you wish we did more of or less of? How has your body changed and what does that mean for what feels good to you now? Share your own experience too. "I feel pressure to perform and it's affecting my enjoyment," or "I'd love to explore more ways to be intimate that don't depend on my erection." These conversations feel awkward at first, but they transform intimacy. You stop guessing and start knowing. Point 6. Sex is not just penetration. Patricia said, "In his mind, sex means intercourse. If his penis isn't inside me, it didn't count." Doctor, some of the most intimate, satisfying experiences we've had lately have been when we couldn't have intercourse because of his erection issues. We did other things. It was wonderful. But he still felt like he failed because it wasn't real sex. That breaks my heart. This is perhaps the biggest mental block for men in their 60s. They define sex narrowly. Penis in vagina intercourse equals sex. Everything else is lesser, compensatory, or not the real thing. Automo. Dando continuidade ao processamento do roteiro em inglês, conforme as regras. Aqui está a part 4, final, do novo roteiro processado, fielmente em inglês. Women generally define sex more broadly. Sexual connection includes kissing, touching, oral sex, manual stimulation, sensual massage, mutual masturbation, and yes, sometimes intercourse. All of these are real sex. All can be deeply satisfying. What to do instead? Expand your definition of sexuality. Intercourse is one option among many, not the only legitimate sexual expression. Many couples over 60 have their most satisfying sexual experiences when they let go of intercourse as the goal and explore the full range of intimate possibilities. Your mouth, your hands, your body pressed against hers, all of this is real sexuality. Give yourself permission to enjoy it without the performance pressure of erection-dependent intercourse. Point 7. We want partnership, not just sex. Patricia said, after sex, he rolls over and goes to sleep. Or he gets up and watches TV. I want to stay connected. Talk. Cuddle. Bask in the intimacy. The physical act is not the point. The connection is the point. He doesn't understand that. For many men, orgasm is the end point. Goal achieved. Time to move on to the next thing. For women, particularly women over 60 with years of relationship experience, the afterglow, the continued connection, is part of sexuality. Abruptly disconnecting after sex, whether it's rolling over to sleep or getting up and leaving, sends the message that she was a means to an end. You got what you wanted, now you're done. That's not intimacy. That's transaction. What to do instead? Build in 10 to 15 minutes of post-intimacy connection. Stay physically close. Hold her. Talk quietly. Express appreciation. That was wonderful. I love being close to you. Or just lie together in comfortable silence, maintaining physical contact. This signals that intimacy isn't just about the sexual act. It's about being together, being connected. For many women, this afterglow time is as important as the sexuality itself. These 7 points aren't random preferences. They reflect deeper truths about sexuality and aging that most couples don't discuss. Truth 1. Women's sexuality often becomes richer after 60, not diminished. Postmenopausal women are free from pregnancy concerns, often more comfortable with their bodies and desires, and more willing to communicate needs. But they need partners who understand that this evolved sexuality looks different than it did at 30. Truth 2. The performance-focused masculine approach to sexuality creates more problems than it solves. When men obsess over erections and performance, they create anxiety that worsens sexual function. When they let go of performance and focus on connection, sexual satisfaction increases for both partners. Truth 3. Long-term intimacy requires adaptation. What worked in your 30s and 40s doesn't work in your 60s. Bodies change. Needs change. Couples who adapt together maintain satisfying sexual lives. Couples who don't adapt watch intimacy die. Truth 4. Most sexual problems in couples over 60 are communication and mindset problems, not physical problems. Yes, erectile dysfunction is real. Yes, vaginal dryness is real. But these are solvable with medications, lubricants, and adapted techniques. The bigger barriers are unspoken expectations, poor communication, and rigid definitions of sexuality. Let me share what happened with Robert and Patricia after that appointment. Robert heard his wife's honest perspective, probably for the first time in years. It was uncomfortable for him. He'd been defining success by his erection and felt like he was failing. Learning that she didn't care about his erection the way he did was both relieving and challenging. We addressed his erectile dysfunction with medication and some lifestyle changes. But more importantly, I encouraged them to keep communicating openly and to experiment with broader definitions of intimacy. 6 months later, they came back for a follow-up. The change was visible. They were holding hands. They were smiling. Patricia thanked me. She said the conversation had opened a door that had been closed for years. Robert said, I spent so much energy worried about the wrong things. Once I understood what she actually wanted, everything got easier. And ironically, my erectile function improved because I wasn't so anxious about it. That's the pattern I've seen repeatedly. When men let go of performance anxiety and focus on what their partners actually want, connection, attention, emotional intimacy, varied physical affection, everything improves. Including erectile function. Now let me give you the action plan. If you're a man in your 60s and this message resonated, here's exactly what to do. Step 1. Have the conversation. Sit down with your partner in a non-sexual context. Tell her you watched this video and you want to understand her perspective better. Ask her directly, what do you most want and need from our intimate time together, and what could I do differently that would make you feel more connected and satisfied? Listen without defending or explaining. Just listen. Take her seriously. This conversation might be uncomfortable, but it's essential. Step 2. Expand your definition of sexuality. Stop measuring sexual success by penetration or erection quality. Start measuring it by connection, pleasure, and mutual satisfaction. Give yourself permission to enjoy intimacy in all its forms. Step 3. Prioritize foreplay and full-body intimacy. Plan for 30 to 45 minutes of intimate time. Spend most of it on kissing, touching, and sensual connection. Don't rush to genital contact. Build arousal slowly. Pay attention to her responses. Step 4. Maintain emotional connection daily. Don't save intimacy for the bedroom. Show affection throughout the day. Hug her. Hold her hand. Kiss her goodbye. Have real conversations. Address conflicts promptly. Keep the emotional connection strong so physical intimacy flows naturally. Step 5. Communicate desires and concerns openly. Share your own experience. I feel pressure to perform and it's affecting my enjoyment, or I'd love to explore more ways to be intimate together. Vulnerability creates connection. Step 6. Educate yourself. Learn about female sexuality after menopause. Understand the physical and psychological changes. This knowledge makes you a better partner. Resources exist. Books, articles, videos like this one. Use them. Step 7. Consider professional help if needed. If communication is too difficult, if there's too much resentment or distance, consider couples therapy with a therapist who specializes in sexuality and aging. There's no shame in getting help. Your relationship is worth it. Step 8. Be patient and consistent. If intimacy has been declining for years, it won't transform overnight. Give it time. Stay consistent with new approaches. Celebrate small improvements. Over weeks and months, you'll see significant changes. Here's the bottom line. Women in their 60s want intimacy, connection, and to feel desired. They don't want perfect performance. They want present, attentive, emotionally engaged partners who understand that sexuality at this age is about so much more than intercourse. If you've been struggling with declining intimacy in your relationship, it's not because you're too old or because sexuality doesn't matter anymore. It's likely because you're focused on the wrong things and your partner hasn't told you what the right things are. Patricia's honest message was a gift. It illuminated the gap between what men think women want and what women actually want. That gap destroys intimacy. Bridging it restores it. Your challenge: have the conversation this week. Ask your partner what she wants and needs. Listen to her answer. Then start making changes based on what you learn. In 30 days, check in again. Ask how things feel different. Keep adjusting. If this video gave you a new perspective on intimacy after 60 and practical steps to improve your relationship, hit that like button. Subscribe for more honest, science-based content on male sexuality, relationships, and health after 60. Turn on notifications. Comment below. Did this resonate with your experience? Are you willing to have the conversation with your partner? What's one thing you'll do differently starting today? Share this with men in their 60s who might benefit from this perspective. Sometimes hearing truth from an outside source makes it easier to receive. I'm Dr. Madison Li. Your sexual and relational health matter at every age. The intimacy you experienced at 40 can evolve into something even richer at 60 if you're willing to understand, adapt, and communicate. The woman in your life wants to connect with you. She's waiting for you to understand what she really needs. Now you know. See you in the next video.